Hello, everyone, and welcome to this episode of Connect Over Coffee. So it's 2021, and we are back with brand new episodes and speakers. So this month is Cervical Cancer Prevention Month, and so we are joined by global expert Dr. Lois Ramondetta to talk about all things cervical cancer, a few extra also. So Dr. Ramondetta is professor at MD Anderson, where she provides surgical and chemotherapy-directed patient care while co-leading the MD Anderson HPV cancer prevention effort, as well as serving on the American Cancer Society HPV Roundtable. So in 2008, she co-wrote a book, The Light Within. If you haven't read this book, I highly recommend it, that explores the beauty and integrity of the doctor-patient relationship. And to better care for patients, she then became board certified in hospice and palliative care in 2010. As if that was not enough, in 2019, she became a certified yoga teacher and is now exploring new methods to further enhance her patient-centered holistic practice. So as you can imagine, we have so much to learn and discuss with Dr. Ramondetta. So, but we have to bring her back for another part two, so she can talk about the role of stress management and yoga in survivorship. But today we are focusing more on HPV and cervical cancer prevention because in honor of the Awareness Month. So let's join us for the next 35 minutes or so as we chat with her. And if you have any questions, please type in the comment sections below and we'll try to address post the discussion. So with that, welcome Dr. Ramondetta to this episode of Connect Over Coffee. Such an honor.
Thank you. I'm so excited to be here. I'm sorry I'm kind of casual and I got my dog here on the floor who didn't want to be without me for the interview.
Wonderful. Yes. So my first question to you is, we have read that according to World Health Organization, 99% of cervical cancer cases are linked with the human HPV. And so can you discuss the advantages of HPV vaccinations and secondary prevention approaches like screening and treating precancerous lesions that may prevent most cervical cancer cases?
Yeah, it's so different than ovarian cancer, right? We wish that we had a great detection method. We wish that we had a vaccine, but we don't for ovarian. But for cervix, we do. We know what causes cervix cancer. We know that in almost every case, it's related to the HPV or human papilloma virus. We know that if you're a human being, involved in normal human being behavior, that you're likely to get exposed to the virus, and that we know that the vaccine will help prevent it in many cases, not all yet. So the vaccine that we use now in the United States protects against 9 different types of the virus. It protects against the 2 types that cause warts, and then 5 types that cause multiple types of cancers, which we can talk about. But using this 9-valent vaccine, the one that protects against 9 different types, we can prevent probably 85-90% of all cervix cancers. And so we highly recommend it. It is safe, it's effective. It was first FDA approved in a form that only protected against 4 types of the viruses back in 2016. So I'm sorry, 2006. So it's been around for, well more than a decade. Yeah. And we should be able to really eliminate this cancer from the world if we're able to vaccinate everyone. And there's complicated issues related to that because there used to be the vaccine was only available for a little bit for women. Then we opened it for men. And now there's some that are calling for us to pull back because there isn't enough supply to vaccinate all the girls around the world. And so there are some organizations, including the WHO, that are saying that we should really focus on just female only vaccination.
So, and building on that, I know that you mentioned about other cancers other than cervical cancer that can be prevented. So as we understand, the HPV vaccination prevents cancers of many kinds in both men and women. Could you tell us what types of cancers specifically it protects from, and the latest guidelines on vaccinations that our overcomers should know in terms of I understand there have been some changes in the age range and other things that you might guide
Yeah.
us through. Yeah.
Yeah. So we'll get to this when we talk about what is the importance for the overcomers. But for one, their families are important. As we said, that almost everybody's going to get exposed. That means their children, their siblings, their grandchildren. And so it's important that they're aware that there is a vaccine that prevents cancer. Now, it prevents almost all cervix cancer. It prevents almost all anal cancers. It prevents about half of the penile cancers, probably about 60% of vulvar and vaginal cancers. And what we're learning, or what we have learned over the last decade, is that the fastest growing group of cancers related to HPV that we are now recognizing is the oral pharyngeal cancers. And those, the oral pharynx is an area kind of between the mouth and the throat, and it's an area right in the middle. And it specifically, although there are a few different types of cancers you can have in this area, the tonsils and the back of the tongue are the two that are affected by HPV subtypes. And they actually occur more commonly in men. And it tends to be, it's very interesting because there is no screening test for them. And so whereas cervix cancer is often related to screening availability, and that might be related to socioeconomic status, the oral pharynx cancers are not, because there is no screening test associated with it. So it tends to be higher socioeconomic status, heterosexual males that are getting HPV of the oral pharynx.
Wow. Okay.
And so it's about 70% of oral pharynx cancers are related to HPV, and almost all of them are related to HPV 16 and 18, which are prevented by the infection is prevented by almost all the vaccines, and by all the vaccines. And so we know that we will be able to reduce this cancer as well. It's just that it occurs in the fifth and sixth decade. And so we will not know for decades to come whether or not we can really make this difference.
But it's revealing that so many cancers can be prevented, not just cervical, but so many with vaccination. So that's powerful. Thank you for sharing this. And so moving on to the risk factors for cervical cancer, if you could kindly discuss the risk factors, and also what are the signs and symptoms of cervical cancer that we should all watch out for and report to our healthcare team.
Excellent. So so I mentioned that if you are a human being participating in normal human being behavior, that you are at risk. And we know that about 80% of the world's population will get HPV at some time. So what's involved in intimacy, relationships involving sexual intercourse. Oral sex is also one of the risks. And there are some studies that have suggested that deep, enthusiastic kissing could be one of those risks as well. There's some question about digital or auto inoculation, so touching your genitals and then touching your mouth. Those are all risks. Now, things that can make you at increased risk are things that make you at increased risk for any viral infection, just like we're seeing with COVID now, immunosuppressed people who are getting steroids for, let's say, rheumatoid arthritis or transplants. So anything that makes you immunosuppressed, and along those lines, stress is one of those things that may potentially increase your risk. So when we talk about risks, it's if you've ever had any sexual partner of any type, that puts you at risk. The second that could increase your risk of holding on to the virus and allowing it to kind of get hold and become a precancer and then a cancer would be stress, smoking, immunosuppression, multiple exposures to the virus, so multiple partners. Those are the main things.
Okay. And
you said signs and symptoms. So there are none. That in the early stages, there are no signs and symptoms. It's only when, and that's why Pap smears are so important. Pap smears HPV testing. I know we'll get to that in a little bit, but the importance is that if you have your regular exams, in most cases, not all, you should be able to pick up a cervix cancer early or a precancer of the cervix and address it with treatment. You won't necessarily be able to get rid of the virus, just like you can't necessarily get rid of a chickenpox virus. You just kind of survive it and hopefully it goes away. The issue is that if if the virus gets into your cells and starts to cause a precancer, that those precancers can become friable or bleed easily. So you might notice postcoital or post-sex bleeding. You could have irregular bleeding between your periods. You may have just longer episodes of bleeding, and many things can cause that. So don't assume that if you have that, you have cancer, but it needs to be looked at. And then if it gets to be a big cervix cancer, you will have pain, and you could have other things that happen. In terms of the oral pharynx, just to mention, usually it's detected late because the men or might be shaving or look in the mirror and notice a little lump in their neck, and it's already spread to the lymph nodes because these happen so far back in the throat that they can't really be readily detected early on.
And so in terms of percentages, as we know that majority of ovarian, like 70% of or more of ovarian cases are diagnosed in later stages. So what would be the statistics, just out of curiosity, for cervical cancer, like stage 1 through 4?
It probably is totally associated with socioeconomic status. So the better access and compliance you have with your screening, in most cases, it's not 100%, but in most cases, it will detect it early. So it is very easily detected early. Now, I have worked in situations where people did not have access to care. For many years, I worked at one of the county hospitals, and the majority of the cases that we saw were late stage. And late stage meaning the difference between an early stage could be managed possibly by a small procedure where you remove part of the cervix. It could be a simple hysterectomy. It could be what's called a radical hysterectomy. But in the cases where you don't have access to healthcare and you maybe come in 5 to 7 years after a Pap smear, you may be presenting what's called local regional involvement, where not only the cervix, but the tissue around the cervix and the local lymph nodes are involved. And in those cases, you are actually going to be dealing with about an 8-week course of chemotherapy and radiation. And obviously the cure rate decreases significantly the more advanced you are.
And you bring up such a great point, because I was just reading that in 2018, as WHO reported, there were like 570,000 cases diagnosed, out of which I think 1/3 was in India itself, where access to care is limited, especially in the rural and the remote areas. So it just speaks very directly to your point.
There's a beautiful story, and I'll get you the link. It was originally sponsored by a drug company, and it was called Michelle's Story. And it's this really beautiful story of a woman who had recurrent cervix cancer, multiple times recurrence, and the opportunities for chemotherapy working in those times when she was diagnosed were very slim. And that's true in many advanced cancers. And she chose to paddleboard down the Ganges River to raise awareness in India about cervix cancer during her last few weeks of life. So she actually had been a very athletic person and was able to do this. And the pictures are just so beautiful. And it makes me think about how sometimes when there are multiple options for therapy available, but the chance of the therapies working become more slim, that it is really important to decide how you're going to spend your time. And it's just such a beautiful story, brings me to tears. And there's a little interview with her daughter where, she felt, her daughter mentions that she felt selfish, that she wanted to be with her mom, but she knew this was something her mom had to do. And she died about 10 weeks after doing this trip. So
Wow, thank you for sharing that. Such a moving and amazing story. So for women diagnosed with ovarian cancer, and this is where our overcomers come in, what are the chances of developing cervical cancer as a secondary cancer and vice versa? And also we have, in terms of extended age guidelines, what is your recommendation in terms of HPV vaccinations for our overcomers? What would you say?
Well, that's a couple of good questions. I will say, let's see, I've been at MD Anderson since I started my fellowship in 1997. So it's been a long time. I have never had an ovarian cancer patient who had cervix cancer. So I'm not saying it doesn't happen, but geez, it's pretty rare. And the risk factors are different, right? So I've never had that. So I think the risk is probably pretty rare.
Story. We don't want, that to happen. So that's great. Then great
Yes.
that.
Yeah. And so I would say that, and you've also in most cases had a hysterectomy. And so the recommendations are if you've had a hysterectomy for a non HPV related issue, that you don't even need screening anymore for cervix cancer. For any woman who's had a hysterectomy for a reason unrelated to HPV, no dysplasia, nothing, maybe they had fibroids or they had a different cancer, there is no recommendation for Pap screening because the risk is so low.
Okay,
Uh,
so
yeah.
just to catch on to that point, so any woman, as you are saying, who has had that procedure, hysterectomy, is
Mhm.
not required to go for her annual Pap smear visits any longer.
So I'm going to clarify. You said visits. So
No, no, Pap smear
yeah,
visits. No,
exactly.
yes.
So no Pap smears or HPV testing should be done on any woman who has had a hysterectomy for a non-HPV related reason. There's no, yes. So once you've had a hysterectomy,
At any point in time, even if it was 20 years ago.
Mhm.
Okay.
Yep. Yeah. Yeah. You're done. You do not need a PAP. In fact, it'd be one of those tests where we might kick ourselves for doing a PAP that was unindicated. Because once you find an issue, for instance, if you find HPV in the vagina, for instance, we're not exactly sure what to do with that, especially in a patient who has never had an HPV related issue. So yes, if you have had ovarian cancer and had a hysterectomy, you do not need Pap smears. Now, that doesn't mean you don't need a pelvic exam. You do. We do look for things with that. And though there are some people who would argue that an asymptomatic pelvic exam is not very helpful either, especially if you're somebody who's getting regular scans, which, I'm sure you've talked about is not recommended unless you're symptomatic.
Okay. So, and in terms of the vaccinations, also, you think for our overcomers, they don't need to get the HPV vaccinations either?
So let's clarify a couple things. So overcomers, I assume, mean all types of ovarian cancer. Is that right?
Right. Mm-hmm.
So in the historically epithelial ovarian cancers, the papillary serous, the very, the ones that many of your survivors have, most of those patients are out of the age range in most cases. And so let me go quickly over the recommendations. So HPV vaccine can be started as early as age 9, and we want to vaccinate all kids, boys and girls in the US anyway, ideally before they turn 15, really during what we call the adolescent platform, when they're getting a Tdap and a meningococcal vaccine, we want to also give them HPV. One of the reasons for that, two of the reasons are, one, they probably haven't been exposed. In most cases, a 9 to 13-year-old surely hasn't really been exposed. And so it's only a prevention vaccine. You need to get it on board before you get it. Kind of like what we're hearing sometimes with the COVID vaccines is if you get that first vaccine, you might have heard a few people have gotten or shown up with COVID between the first and the second. It's because you are not protected. So you want to get it before they have been exposed. The second reason is that your immune system works so much better when you're younger. As we know, the older you get, the more likely you are to get the flu, pneumonias, things like that. So you want to get it early. So the main recommendation is start at age 9, up to age 15. One day short of your 15th birthday, you only need 2 shots, about 6 months apart. Doesn't matter if it's longer, as long as you get it on before they're exposed. And then once you turn 15 to age 26, you're supposed to get 3 shots. Also, immunosuppressed people will always need 3 shots. So up to 26, and that's the recommendation. If you're over 15, it's considered late. As a physician, if you haven't given it to your patient or recommended it to it, you're really giving them not the best protection. Recently, the FDA approved us giving it up to age 45, and the recommendations are kind of iffy in there. The amount of cancers that will prevent during that vaccinating age 27 to 45 is very small. And though there are people who may fit into that group. So let's say you have a uterus in place. Let's say you're married and you either get divorced or you are widowed for some reason. You might be re-exposed. Your uterus is in place and you may be going out into the world again. And in those cases, it may make a lot of sense for you to get it. So So in terms of the overcomers, people who've had a hysterectomy don't need it. People who have, let's say, one of the stromal cancers or maybe a germ cell tumor, maybe in the younger age group and may be sexually active and may still have the fertility preservation there. And they may be people who want to go forward with this. And I would probably recommend it, especially if they're under age 27.
Okay, so basically that means that depending on your age group and the type of ovarian cancer you've had, it is worth a conversation with your physician
Yes.
as
If
to
your uterus is still in place.
correct what plan you should have. So thank you for that. So I'm moving on to the screening test, the experimental screening test called Pap Seek, which we've been reading about for the last couple of years, I think, and so it says that it can detect some forms of endometrial and ovarian cancers at earlier stages. And so,
Yeah.
can you tell us about this or any other similar new advances in the horizon?
I think circulating DNA tests are becoming more interesting in order to detect early circulating cancer cells. I believe we're still in the research stages. It's interesting though that um, in terms of head and neck cancers, detecting evidence of HPV DNA, whether it's just the E6, E7 antibodies to the E6, E7 proteins or not, are actually able to detect recurrences earlier in head and neck cancers. We haven't seen the same thing in cervix cancer. Uh, I think this is probably the way of the future, but we aren't there yet.
So the PAP-seq test, as of now, as you're saying, that although it's showing promise, it's largely experimental at this point in time, and the time to market isn't anywhere close in the next 3 to 6 months range.
Oh, no, definitely not in the next 3 to 6 months. And in fact, I can give reference. I think we'll post this online that there will be our cervical cancer screening guidelines from MD Anderson can be accessed online, like a little algorithm, which can be very helpful. And another algorithm that's also very helpful and that would also indicate when this becomes non-experimental is what we call the ASCCP guidelines. I always forget the actual acronym, but it's American, call it ASC, American Society for Cervical or Colposcopy and Cervical Pathology, ASCCP. And you can actually download the app yourself if you are somebody who's um, in that range to look up exactly what your screening recommendations are based on your age and your prior history of Pap smears. So MD Anderson has an algorithm as well, but the Pap-seq is not part of it as of this point.
Okay. Switching gears just a little bit, and we have just a teaser question before we bring you back on for the second part of this interview series. Is tell us about the emotional and physical benefits of spiritual well-being. And you've done so much research and study on this when someone is going through the cancer experience. And how, in your opinion, does it impact psychological outcomes in ovarian cancer survivors?
So there's so many variables with this. And part of the issue is the terminology, right? So spirituality to probably everybody listening on this call is different for every person. And yet there are some commonalities and mostly it pertains to having a sense of connectiveness to something bigger than yourself. And whether that's through religion or art or nature or your family, is different for every person, but having a connection to something bigger than yourself is so important. Depression does play a role in how people do. You, if only to even affect your immunosuppression. We know that people who are depressed don't do as well, and we know that we were talking about that woman who was paddleboarding down the Ganges, if for nothing else than to find meaning in every aspect of your life, regardless of how much life you have, it is hugely important. And I would say that it's even more obvious to all of us right now in these really difficult times. It is so hard not to allow your brain to run down a rabbit hole of despair because of COVID. And I feel like what I've learned, one, for myself, is that this takes an everyday moment to moment effort. And that effort usually involves meditation. It may involve some breathing exercises, even if it's just to extend your exhale longer than your inhale. And then find your connection. And a lot of that comes through finding compassion towards the people around you, being grateful on a daily basis. There, it sounds so silly to recommend a gratitude diary to people, but it is the easiest thing to really do. And it's a great thing to do with your kids and your grandkids, to just pull out your gratitude diary at night and just find something, because we can habitually find the bad things as well. Um, the I've lost my train of thought, but I do think that I have learned that it is a daily effort, and that surrounding yourself with people who lift you up is also equally important. Um, it's a really tough time. And I think reaching out to people, even these days, just to send a little note to somebody and just say, hey, I was just checking on you and making sure you're doing okay, could make all the difference.
And
I'm
we absolutely need to bring you back in for the second part of this, because we want to. I know that our audience and our overcomers would love to learn about, simple things. You talked about simple things of how you manage your day-to-day life and living and gratitude and managing depression and stress and anxiety. These things are so important while you're going through survivorship and the fear of recurrence. How do you manage all of that? And so I know you're doing a lot of clinical trials and studies on that. So
Yeah.
we would
Let
love.
me mention that just for a second. So, in terms of cervix cancer, we did launch this year a funded translational study with cervical cancer patients. And so, one of the, all cancer treatments are hard. Chemoradiation can be really rough. And in fact, when somebody's getting chemotherapy for ovarian cancer, very often it's very scary, right? It's very scary to get it. But usually within the first two treatments, people feel better. Their ascites dries up if they presented that way, sometimes the pain. And although there is some improvement with pain for cervix cancer patients, that 6 to 8 weeks of chemoradiation that I talked to you about, it's really rough. It's exhausting. You lose energy. You can have worsening diarrhea. You hopefully have less bleeding. So what we did was launch a study involving yoga therapy for cervix cancer patients, a randomized study. We're looking at translational markers, including cytokines of inflammatory markers. And we are involving yoga therapy, which is it's not just you're thinking, how could I do yoga? It's not the Western yoga. It's yoga that involves breath work, meditation, and some gentle stretching. And we are doing a randomized study right now, and we've enrolled one patient so far just to open. We had to redo the whole thing when COVID happened because it was in person. And so now we're doing it by Zoom. But I am really excited about that. And along those same lines, I recently gotten involved with a group called the American College of Lifestyle Medicine and got my certification just last month. And it's just such an important part of cancer care that we have not addressed, even just what we should be eating, how we should be sleeping, how do we manage stress, and how important that is. And you really recognize how important these things become when you get into the third, fourth, and fifth line chemotherapy, when you're talking about response rates that are very small sometimes. And your potential to make your life better by making some small lifestyle changes is huge. And we should be making those definitely for the Ovarcome survivors. They should be making these changes now.
Yeah, and so like I said, we have to talk to you about this in our round two, because it sounds definitely promising and very exciting. And this gives an option to all of us, not just ovarian survivors, but all of us, to just enhance our lives and our lifestyle, right? So thank you for sharing that. My last question is, as we close out this discussion, what message of overcoming would you like to share with our audience?
Well, I'm going to keep it to cervix cancer on this. And here's what I'm going to say is that people who've experienced cancer are, I'm not giving you extra jobs, but you have an experience that you can share with other people. You know what it's like to be diagnosed with cancer, maybe the isolation, maybe the overcoming, the ability to rise above. And because this is Cervical Cancer Awareness Month, educate yourself about the vaccine. Get your kids and grandkids vaccinated. Get your nieces and nephews vaccinated. Keep pushing for that, great detection test for ovarian cancer, which we will have someday. But right now we have one that can prevent so much suffering, and nothing makes you want to kick yourself more than being diagnosed with a cancer that could have been prevented.
Yes,
So be that champion, and show people how to overcome the fear of having your life flash before you.
that's a very powerful message. Thank you so much, Dr. Ramondetta. This was a great discussion. And like I said, we have to bring you back for the second round very soon. And Overcomers, keep watching and keep listening. And we will be back with the next episode of Connect Over Coffee very soon. Until then, keep talking about ovarian cancer. And remember, this is Cervical Cancer Awareness Month. So go out and raise awareness on this very preventable cancer. Until
get your kids vaccinated.
Yes. Until then, bye.
All right, bye.